Sam, so what do you consider the biggest challenge to be right now for payers in healthcare, and how do you think technology can help address this challenge?
I think the biggest challenge, well, I would say there's two, honestly. There's data and analytics for providers to help them practice better medicine, to improve population health and reduce per capita healthcare costs. And on the other side with consumers, to engage consumers so that they are better informed in choosing healthier behaviors, whether it's selecting high-value providers or changing lifestyles and so forth. I think that information to help them both change their behaviors to achieve better outcomes is crucial.
And how do you think technology could help address some of these issues?
Well, technology is very promising. It's very, very exciting right now because of the data and analytics, the sophistication and connectivity between payers and providers would be very, very helpful to help them basically close gaps in care and achieve better health outcomes. Similarly, technology with engaging consumers to help them make better choices, to understand the differences and the inconsistencies in medical practice that they could actually have a role in closing and mitigating would be very, very helpful. So whether it's technology related to connectivity, technology on data and analytics, technology for consumers and wearable devices, just technology that can embed decision support into electronic medical records for physicians, all that technology has tremendous potential to actually move the needle in improving healthcare.
We know there have been a lot of changes in policy, new federal regulations that are impacting payers, particularly around technology and healthcare delivery. If you could make one change, one policy decision that you think would greatly impact and help payers deliver better care, what would it be?
I don't know if I have a single policy change, but I do think that there should be much more active collaboration between government policymakers and the private sector to remove the onerous and unnecessary policies and to promote policies that would let innovation and private sector solutions flourish.
You've been a long-standing member of the eHealth initiative. What role do you think EHI can play in addressing that very issue?
Well, EHI is just a tremendous forum of multiple stakeholders who are all focused on not just improving health information technology, but actually focused on transforming American healthcare so that patients can get better outcomes, doctors can practice better medicine, and all healthcare constituents can actually benefit from the reasonable, innovative, judicious application of advanced health information technology. So EHI is an incredibly unique voice because it has all the stakeholders, and in particular, whether it's in the nonprofit or for the for-profit world, it really brings out the best practices in the private sector to better inform government regulators and policymakers. I think EHI's potential to contribute further to innovating healthcare is just scratching the surface.
If you had to describe the current state of healthcare technology in one word, what would it be?
One word, I would say is promising. Very exciting, very high ceiling in terms of potential, but ultimately promising because it's not yet fulfilled.